Lovely day here in H-Town, folks. Looks like the Southwest Freeway is moving right along. Okay, let's talk about some weight loss issues, folks. Can't seem to put down the bag of chips or get into the gym. That's my problem. Our next guest promises to have a solution that can reshape your body with minimal downtime and zero discomfort.
It is called Smart Lipo. Here with all the details is cosmetic surgeon Dr. James Kern with the Image Enhancement Center, along with his patient Michelle, who received the procedure. Welcome to both of you. Okay,
thanks.
My ears perk up whenever I hear about lipo, procedure, tummy issues. No downtime? What's the deal?
Well,
very little.
I should say very little downtime. Most of my patients, I discuss what they do, what kind of work that they do. And ladies who are secretaries, ladies who spend most of their time in front of the computer, etc., we tell them, have it done on Friday, rest up over the weekend, and you should be back at
That's
work.
amazing. That's really
It is amazing.
fast. And Michelle, you look great. We're going to chat about your story in just a minute. But Dr. Kern, if you could just describe to us, what exactly is Smart Lipo? How is it different?
Smart Lipo, basically, we work through tiny little openings, rather than incisions, little openings that I make with a needle. We use tumescent fluid, local anesthesia that we pump inside to take away the discomfort. And then we use laser light to kill the fat cells and liquefy the fat. The fat cells do not grow back. Now, one of the things that we do that's rather unique is that rather than just sucking out the liquefied fat and the broken up fat cells, then in order to do that, I will also use an instrument they call the tickle lipo, which is actually another machine to do a slightly different form of liposuction.
By the way, we're seeing video of the procedure right now.
There's the tickle lipo right there.
But we should also point out that your patients, they're not under general anesthesia. They're awake during this process.
They're not at all. The patients are awake during the process, although I will say some of them lying there on the table will fall asleep, and
take a little nap.
Actually I've had patients who snored through most of the procedure on their own.
That's annoying. They snore on you? No, I'm kidding. No, that's great.
So, Michelle, you've had this procedure done.
Right, yes.
And you were awake, or were you the snorer? I'm just kidding. You don't need to answer.
Oh, I was a little of both.
What was it like for you? First of all, before we get to the reason why you did it, but what was that procedure like?
It was easy. I mean, it was like you go in, they give you medication, you get a little tired, and at one point I know for sure I was one of the ones probably snoring, and then I woke up for like 1 second at one point, but then I went right back to sleep.
And let's talk about what happened after the surgery. Here's your before picture, by the way. We're about to see an after, but the recovery time, and wow.
That's
you
amazing.
can see the difference for sure. How did you feel during the recovery period?
I felt okay. I just took my pain medication as prescribed. I did try to stay ahead of the pain, so I tried to make sure that I was taking it just a little tiny bit early. But other than that, I was able to move around, get up, lay down. I live on the 3rd floor in an apartment complex, so you kind of had to be able to be mobile by yourself.
And the before and after of your back too?
Unbelievable.
That was a dramatic difference too. Your waistline looks so small. There's the photo again.
So this, I mean, it basically, Dr. Kern, you can do this tummy. That's what I think of first of all. So tummy, but other parts of the body as well?
Most commonly we do the tummy and the flanks, but sometimes we'll do the inner and or outer thighs. Sometimes we'll do the upper arms with the hanging skin there.
Right.
We do chins. We do lower areas in the back.
So who's a candidate? I mean, I know that you have to go through and have the consultation part, but who's the good candidate here?
The good candidates are the patients who have a moderate to a low amount of volume in those areas. For patients who really have a lot of fat, then they should probably be done in the hospital under different circumstances. Or some, of course, need a tummy tuck because they have the loose skin in their abdomen.
We are seeing some before and afters of some other patients, but in addition to the short recovery time, you're also given compression shorts or compression garments that people can go home and wear.
Compression garments that helps tighten the skin to the new shape since we've taken out fat, so that the skin can heal in conform to that new shape that we've given the patient.
Got it. And you guys have an open house and a live demo coming up.
We do Thursday evening.
This Thursday.
Yes.
So people can come and actually watch this procedure happening on someone?
Well, they
Not so much?
We can show them some of the other procedures. This, although it's very minimally invasive, nonetheless, this is a procedure that requires a sterile technique, etc. So we can't let strangers come into the room.
Look at these demos, though. I mean, the True Sculpt is happening at 3:30 p.m. Tattoo removal, which I know a lot of people are doing these days. Botox and picogenesis and melasma treatments.
That's great. It's called the Tax Party Return. I love it. Live demos going on there. And of course, big specials on all procedures and services. And do we need to call to make a reservation, or we just show up?
Well, we would appreciate it if they would call, but nonetheless, if they desire to show up, if suddenly things change and the time is open, they're welcome to come.
Perfect.
All right, Dr. Kern, Michelle, you look great. Thanks to you both for stopping by.
And for more information and take advantage of that open house deal, the number you need to call, 713-77-IMAGE. That turns out to be 713-774-6243, or check out imageenhancementcenter.net. Thanks again.
All right, and stick around because there's much more Houston Life right after the break.